Good morning. Thank you so much for spending your time learning about this very important topic that we're going to be discussing today, suicide prevention and substance use disorder, and the overlap between substance use disorder and mental health. My name is Allison Jimenez. I work at Hanley Foundation, and I lead the Zero Suicide Initiative. This topic that we're going to be discussing today, it is not a lighthearted conversation. These are two very serious and important matters in our society that have to be addressed, because the only way that we can create change is to have difficult conversations that are absolutely necessary. So before we begin, just wanted to say, if at any point this topic becomes difficult to process or handle, please feel free to take a moment for yourself. Again, this is not a conversation that's always lighthearted. So if you need to take a moment, please do so. With that being said, we're going to start out today's webinar discussing some data on suicide and why it is so important that we have these conversations. In 2020, 45,979 people died by suicide in the United States. So that's approximately one death every 11 minutes. 12.2 million adults seriously thought about suicide, 3.2 million adults made a plan, and 1.2 million adults attempted suicide. Those numbers are staggering. My son attends a high school here in Palm Beach County. 3,113 people died by suicide in Florida in 2020. That would be the equivalent of my son's entire high school dying by suicide. And when you put things into perspective that we can all relate to, it really makes things much more real. It makes the crisis that much more important to discuss. Now, if you see the differentiation between the amount of people that died by suicide compared to the amount of people that attempted suicide, there's a very large change in numbers, right? Because for every one person that attempts or that dies by suicide, at least 25 people attempt suicide. So when we think about Florida's numbers, we are 7% of the US number of deaths by suicide. And unfortunately, from 2015 until now, or 2015 to 2020, the rates have steadily increased for people ages 15 to 34. As you can see on this graph, there are multiple age groups listed, and the ones that have continuously increased are the age groups of 15 to 24, 25 to 34. And as you'll see, the other age groups, there have been declines each year. There could be a number of reasons why this might be. Some people blame it on social media. Some people talk about the pressures that teens and young people are now facing, whether it's with their curriculums, their coursework. We saw a big, increase in 2020 when mental health crisis, when COVID came into the world. And so we continue to see people, especially young people, struggling with their mental health. So how do these staggering numbers coincide with substance use disorder? There are a lot of ways that they coincide, but the facts are that individuals with a substance use disorder are nearly 6 times as likely to attempt suicide at some point in their life. Men with a substance use disorder, they're more than twice as likely to die by suicide. But women with a substance use disorder are 6.5 times as likely to die by suicide. So even though we see statistically that more men die by suicide, when you factor in substance use disorder, women are actually more likely to die by suicide. And the reality is suicide and substance use disorder do not discriminate. So it does not matter what you look like, it does not matter where you come from, it does not matter your race, your ethnicity, your socioeconomic status, whether you live on Palm Beach Island or one of the worst parts of Palm Beach in West Palm Beach. Anybody can be affected by suicide. So it does not discriminate in any way. Neither does substance use disorder. Any person can experience a substance use disorder or a suicide crisis at some point in their life. In fact, suicide is a leading cause of death among people who misuse alcohol and drugs. As you'll see, that data is from 2008, but it is still relevant and it is still a leading cause of death. Nothing has changed, unfortunately, since 2008. So when we want to talk about the connection between addiction and suicide, suicide is the 10th leading cause of death in the United States. When we think about our young people, ages 10 to 24, it's actually the second leading cause of death for that age group. And as we had mentioned some of those numbers earlier, back in 2019, 1.38 million people attempted suicide in the United States, whereas 47,511 Americans died by suicide that year. 90% of the people who have died by suicide have a mental health illness or substance use disorder or both. So when we think about that overlap between mental health, substance use disorder, 90% of the people who died by suicide had a mental health illness or substance use disorder or both. So when we think about drug or alcohol abuse, this is going to increase the risk of suicide by 6 times compared to people who don't use. Of those who died by suicide, 33% tested positive for alcohol, 23% tested positive for antidepressants, 20% tested positive for opiates. So again, this is data from 2019, but as you can see, based on all the other numbers we talked about, these are very serious problems that continue to be problems. What we know is that intoxication lowers inhibition. It's not something that most people are unaware of. Most people, especially even teenagers, young adults, or older adults, we know that if we are intoxicated, it is going to lower our inhibitions greatly. So 22% of deaths by suicide, this is the most recent data, involved alcohol intoxication. Opiates, including heroin and prescription painkillers, were present in 20% of suicide deaths. Marijuana was present in 10% of suicide deaths, and nearly 5% of deaths by suicide involved the presence of cocaine. Amphetamines were present in 3% of suicide deaths. So as you can see, it doesn't necessarily matter which substance it is. A majority of them play a part in suicide deaths. And as we can see, opioids and alcohol are the number one substances that are present in someone's body when they die by suicide. So the harsh reality of substance use disorder and suicide, it can be difficult to differentiate between an overdose and a suicide. So you may be wondering, what does that mean? Well, when we get data of someone dying by an overdose, that's the cause of death. The reality is, we don't know if that was intentional or not. So the data, despite it being as accurate as possible, it's not always 100% accurate when we think about overdoses and suicides. Very similar thing with a single car crash. If somebody gets into a single car crash at a high rate of speed, we do not know if that was an accidental car crash or an intentional suicide by car crash. And so we really need to recognize that it is difficult to differentiate between an overdose and a suicide. And that is a harsh reality that we have to process in this field and recognize that both of these, substance use disorder and suicide, are conversations that we absolutely have to have in order to mitigate these issues in our society. So the scope of the problem is that nearly 1 in 12 adults has a substance use disorder. If you're in a room of 12 people, at least one of them, more than likely, has a substance use disorder. The other realization is that if we're on this webinar together and there are 20 people here, at least 10 of us have been directly impacted by suicide or substance use disorder, whether that is us knowing someone who has died by suicide, knowing someone with a substance use disorder, or us ourselves struggling with one of the two. So let's talk about opioids. We've heard about, the crisis with opioids, it's an epidemic, it's all over the nation. In South Florida, we are very well known for being the rehab capital of the country, right? We are known for being, back in the early 2000s, a pill mill. Palm Beach County specifically was very well known for prescribing opioids at very high rates, right? So when we recognized there was an issue, we had to fix that issue very quickly to mitigate these rates of substance use disorder. The reality is, though, despite the work that we've done to mitigate all of the risk of substance use disorder when it comes to opioids, we still have a lot more work to do. Because 75% of the nearly 90,000 drug overdose deaths in 2020 involved an opioid. It's associated with a 40 to 60% increased likelihood of suicidal thoughts, and it increases a suicide attempt risk by 75%. Those are very high numbers, especially when we talked about the other drugs that could contribute to suicide. Opioids have a very increased likelihood of suicidal thoughts. So how can we combat these staggering numbers? It's important to be proactive rather than reactive. Prevention and education is what can change minds and save lives. At Hanley Foundation, we have a number of initiatives that we are doing to recognize and bring awareness to these issues. Because if we are constantly reactive to a problem, we're not fixing the actual problem. We're just responding to it. But if we can be proactive and incorporate prevention and education into systems of care, into our school district, into health care agencies, behavioral health agencies, that is where we can make adequate change, where we don't have to be a reactive society because we've already taken the steps to prevent and educate. One of the initiatives that we're leading here is the Zero Suicide Initiative. The Zero Suicide Initiative has 3 main portions that we're focusing on. First, we want to address that there are fragmented systems, and we have to, again, have these difficult conversations and recognize there are gaps in services. There are gaps in care. Fragmented systems affect a lot of different groups of people. But when we talk about fragmented systems, we're talking about access to care. We're talking about adequate care. What is the review process for somebody who is referred and admitted to a mental health facility? Are they following their assessments? Is there an adequate number of people reviewing someone's chart before they are released? Are we ensuring that that person is safe? Are we ensuring that we are following up with them? And are we ensuring that everybody has equal access to care in the event of a mental health crisis? The other part of this is training, repairing, and restoring. So we are training not only healthcare and mental health agencies, we are also training the public. So whether somebody is a bus driver, a janitor, a teacher, a police officer, a firefighter, a parent, regardless of someone's role or many roles that they may wear every day, we are making sure that people are trained in suicide prevention. And we are doing this through the QPR training, which I will discuss later on. We're also repairing systems. The reality is people become complacent in their fields. It's nothing wrong. It's just a reality. And we have to recognize that when we become complacent at times, we get comfortable in our fields, we get comfortable being experts, and we don't recognize what could be repaired or what could be restored. So part of the initiative is going into agencies, having them do a self-assessment on their practices, and then recognizing where do we need to improve, what can we repair, what can we restore that maybe you were doing before that was working that you may not be doing now. The third part of it is transforming their system. Are there policies and procedures that we don't really need to be using? Are there policies and procedures that are not being enacted properly? Are we screening people adequately for risk of suicide? And are we providing quality patient-centered care? What does the follow-up look like? Because the unfortunate truth and data that we found when doing the research before launching the Zero Suicide Initiative was that the majority of people who were dying by suicide had seen a healthcare provider within 1 year of their death, usually within 1 month. And a large majority of people were dying by suicide within 24 hours of release of a system of care that was designed to protect them and keep them safe. So again, goes back to fragmented systems. How can we ensure that the deaths are minimized and that we are reducing the risk? The training that we're offering to anybody in the community is a QPR gatekeeper training. It is recognizing the warning signs of suicide, questioning that person if they are thinking about suicide, persuading someone to get help, knowing what to say and how to offer that help, and then referring them to help. How and who are we referring that person to? Knowing how to get help and how to save a life. We're also talking about the suicide warning signs because the majority of suicide deaths are preventable. In fact, suicide is one of the most preventable kinds of deaths. But if we don't know what to look for, we cannot help someone. And that is a reality that we also must talk about. As a mental health counseling intern, a lot of people will ask me when they've lost someone to suicide, well, what could I have done differently? The reality is, if you don't know what to do, there is nothing you can't do. But we can, again, be proactive moving forward, recognizing those warning signs, talking to other people about suicide, experiencing what they feel is an unbearable pain, talking about dying, having no reason to live, feeling trapped, feeling like they might be a burden to other people. Then we want to talk about some of the moods: depression, loss of interest, irritability, rage, humiliation, anxiety. And then behaviors: withdrawing from activities, searching for ways to die by suicide, acting recklessly. Again, we talk about maybe somebody that's drinking and driving, an increased use of alcohol and drugs, sleeping too much or too little, giving away prized possessions, isolating, or even making amends with people that they haven't spoke to in a while. And so these are just a few of the warning signs that we discuss in our trainings. But these are some very common behaviors that are oftentimes overlooked. Or people will think that someone's just wanting attention. Well, they do want attention. They want to know if someone cares. So they exhibit these behaviors. They make these indirect comments. Maybe their mood changes. And there's a lot of variations, again, for why this can happen. But as we've seen in the numbers, oftentimes we see the overlap between substance use disorder and suicide. Another initiative that Hanley Foundation recently launched is the Safe Prescribing Initiative. So 7.2% of high school students reported currently misusing prescription opioids. This data is from 2019, but again, it's the most recent data that we have. But based on our current findings and the research that's being continued currently, these numbers have not lowered. So of those high school students misusing prescription opioids, 59.4% also reported underage drinking. So the Safe Prescribing Initiative has two main goals, and that's to increase awareness of the danger of children and adolescents' addiction or misuse of prescribed opioids, and to increase the number of parents and young adults who can elect alternative treatments for pain management instead of opioids. Ultimately, we want our community to know the risk of prescribed opioids so that we can manage the outcomes. So we're also working with a local team of physicians throughout South Florida who can review our Safe Prescribing Initiative's goals. They can review our Safe Prescribing Initiative's pamphlets and information to ensure that the information that we are putting out is accurate, relevant, and necessary to share. And by having a team of doctors who so firmly supports this mission, it not only shows the importance of this in our community, but it shows the importance of it in the medical field, and also having that support of doctors who can now change their prescribing methods and their prescribing guidelines that they may have. Another initiative that we're doing with substance use disorder is we have a Lifesaver Patient Aid Fund. This Lifesaver Patient Aid Fund has helped save thousands of people. It's done so by providing life-saving treatment to people who cannot afford quality treatment for substance use disorder. So anybody who otherwise would not be able to afford treatment, the scholarship can provide treatment to them. Saving lives is our mission at Hanley. And we can all be agents for change and hope as long as we are willing to have these difficult conversations that are very necessary. Thank you so much.